Have you been told you need to stop doing what you love, whether it's exercise, running, or a sport? Well, here at Dynamic, we don't like that answer. In this podcast, we'll talk to leaders in the health and wellness space from Southwest Florida to get the solutions you need to get you back to doing what you love. Welcome to the Dynamic Naples Podcast. What's going on in Southwest Florida? Doing a solo version podcast today. This one I'm calling, is it your hip or is it your back? It's a question I get very frequently, and to be quite honest, it kind of doesn't matter because we're going to treat what we see at the end of the day. But I wanted to give you some info anyways. I know it's nice to know what's going on. So in general terms, if you're just trying to figure out, is it your back or your hip? And sometimes it can be both for sure. And a lot of times it is. Generally speaking, your back pain will be provoked with back movements. Your hip pain will be provoked with hip movements. So one of the first things I'll do, I'll look at your range of motion of your lumbar spine. So let me back up. Location definitely matters too. We'll get into more location of the pain and the type of pain as well. But if I have you standing and I have you bend forward, usually that pain is associated with with the discs of the low back. If leaning back tends to bother you, that usually is more joint-related pain of the spine as well. So if you're leaning back like you're doing limbo, that causes closure of the spine. So if you've got any kind of arthritis, stenosis, degeneration, all those things are usually provoked with leaning back. Bending forward pushes the fluid backwards. So if you have in your disc, so if you have a herniated disc, that's going to tend to provoke it more. But again, these are very general things, and you can also just have muscle pain, and you can have muscle pain that hurts with leaning back or bending forward too. This is where we have to kind of touch the muscle, see how it reacts, see what kind of movements bother you. There is a muscle called the quadratus lumborum that very often gets irritated, and people go get an image. They find something because that's what you do with an image. As long as you're over 20, you're going to find something. That gets blamed, and oftentimes it's just the muscle. Then I'll have you side bend, and that's another good way to tease out that quadratus lumborum muscle. And I'll have you do rotation. If something like that provokes the back pain, there's a good chance that that's true low back pain. Now with the hip, I'll have you move your hip around, or I'll move your hip around passively. I'll look at how you can do hip flexion, extension, internal and external rotation, abduction, adduction. Those are 6 main motions of the hip. If one of those tends to bother, I'm thinking hip. Now, there is one that's kind of a tricky one. It's called your SI joint, your sacroiliac joint. Actually, it's a very controversial topic in the PT world. About half the PTs out there think it can't be a pain provoker. Another half thinks it does. I happen to be in the camp that thinks it does because I've been through it myself, and the techniques that we use to fix it seem to work. So I think it is a thing. Maybe the mechanism under how we fix it, maybe not greatly understood, but so anyways, the sacroiliac joint is where your sacrum and your pelvis meet. So that's kind of the go-between of your spine and your hip. The classic sign with that is sort of rolling in bed hurts a lot. Unilateral movements like a lunge can hurt a lot. Sitting in a car for a long period of time can hurt a lot. And if you can take one finger and point to a very specific spot in that low back area, chances are that's your SI joint. SI joint pain usually comes from big asymmetry from side to side. So first of all, it's sort of fallacy that we think we're perfectly symmetric. I mean, our life is not symmetric. The organs in our body are not symmetric. Just think of like you drive with your right calf all the time, right? So just life is not symmetric, so neither are our bodies. But the further we get from symmetry, like let's just say one quad or one hamstring was super tight on one side versus the other, the greater that discrepancy, the greater the likelihood of that SI joint dysfunction. So that's the one kind of weird one. So then you also have your hip. So the hip gets pretty complicated. So just for some examples, you can have muscular pain. It's super common to have glute medius pain. The piriformis that's a muscle sort of deep in the butt that also will tend to get irritated with SI joint, and also will get irritated when driving. That can get tight enough where it compresses your sciatic nerve. Then you've got joint-related pathology. You can have a torn labrum. You could have a bursitis of the hip, so if it hurts to lay on your side, that tends to be more of a bursitis. Then you have hip impingement, which is kind of my specialty. That's a very complicated topic, but that's where there's a bony change in the hip, in the socket. So either the socket grows a little too long, or the neck of the femur grows sort of a bony bump. It usually happens somewhere in the teens, usually through sports, and that can kind of scrape the labrum away. And the classic sign is pain in the front of the hip when squatting, which oftentimes gets blamed on a tight hip flexor, and most of the time it's not. Hip flexors can cause pain, just like any other muscle, but that is less common than a hip impingement. And then you've got radicular pain. That's if you say sciatica, that's what we're talking about. Radicular pain, pain that radiates. So location matters. We can kind of tell if it's coming from your spine, like how far down your leg will dictate what level of the spine. But the SI joint can get so inflamed where it can create leakage onto the sciatic nerve and cause radiating pain. The piriformis can get tight enough to compress the nerve and cause radiating pain. And I think there's some other places as well, but definitely can come from a herniated disc or a stenosis. So this again goes to what hurts. So, what provokes the pain? What makes it better? Does side bending your spine, which closes the vertebrae down, provoke it? And then side bending away, which opens it, alleviate it? Then we think it's the spine. If using your piriformis, which is external rotation of the hip, if that provokes it, we're thinking maybe that's the piriformis at play. Is it something that if we can reset the sacroiliac joint and make it better, that's a good sign that's coming from the SI joint. And so when we say radiating pain, we're talking about usually numbness or tingling down the leg, or sometimes sharp pain, or burning. And just a little tidbit, there is peripheralization and centralization. So as the further down your leg it goes, we call that peripheralization. And as it starts to recede up towards the spine, that's centralization. So that we kind of look at that as you're going through rehab. If you're doing an activity, this is just good for you to know. If you're doing an activity and it seems to get worse and travel further and further down your leg, that's a bad sign. You don't want that to happen. You want it to recede and centralize. So if you're, say, driving the car for a long time and the pain is radiating to your knee, then it starts to go down to the shin and then down to the foot, you got to take a break, walk around, do something that's going to reduce that, because that's more and more compression of the nerve. If you can find a movement that makes it recede up towards your spine, or whatever location, that's actually much, much better. And also, numb and dull is worse than sharp and burning. So kind of the worst amount of compression you can have in the nerve would be all the way down to your toes with numbness, dull pain, and even worse if you have weakness. Like if you start getting like loss of motor control, that's a lot of compression. That is borderline emergency. So if your foot's like no longer can be lifted up, like a foot drop it's called, that's a reason to go see urgent care. So that's a very broad overview. Of course, it's the body. It gets way more complex than that, because generally where the pain is, we have to look next door to find out what really is going on. That's where the thorough evaluation tells you things, right? So if you're stiff, this is a for example of the spine. Say L2 was stiff, one of the vertebrae in your lumbar spine. Generally, because you're still human and you still need to bend and rotate, the vertebrae above and below tend to be extra loose because it's taking on the motion that vertebrae is not doing. And sometimes that creates the pain. So a lot of times we have to fix the stiffness and stabilize the looseness. That's a very general template we use in physical therapy, and this can happen on a much bigger level. So say your hip was really stiff, you had no rotation in your hip, well then the neighboring joint, which could be your SI joint or could be your lumbar spine, takes on more motion, especially if you're doing something rotational like, say, golf or pickleball like down here. So more often than not, there's an underlying issue. There's the symptom and then the issue. And so is it the hip or back? Well, it's generally both. So as you can see, it's pretty complex. And I love treating the hip and back. So right now, starting today is August 24th, until the end of September, I'm going to be running a special free evaluations for anybody with low back or hip pain. All you have to do is email me, Chris at Dynamic Naples, and just write, I have back pain, or I have hip pain, or I don't know, I have back and hip pain, something like that, and I will respond to you and we'll set up a free evaluation. So that's all I have for you, Southwest Florida, for this week. I'll be talking to you soon. Do you have unexplained pain, or do you wonder just how healthy you are? When was the last time you had your blood tested? Blood chemistry analysis is a great way to stay ahead of any health conditions, and now you can have control of your health with Let's Get Checked. Let's Get Checked is an incredible company that sends blood tests to your home. You can choose from over 30 different tests, whether that's liver function, testosterone, micronutrient, cholesterol, or C-reactive protein, which is a marker for inflammation. It's sent to you with free shipping, and you get your results in 2 to 5 days, no physician referral needed. Use the code DPT30 for 30% off. Go to letsgetchecked.com and use the code DPT30. Did you know that you can get started with physical therapy without a physician's referral? Physical therapists don't just solve pain, we get down to the root cause and keep it from coming back. We also discuss all things health, such as nutrition and lifestyle changes. If you feel that you could use some help, let's get on a free consult call. Go to www.dynamicnaples.com and sign up for a free call. Also, if you like this podcast, please give us a rating wherever you listen to podcasts. It helps us spread the message. Thanks for listening, and we'll see you next week.